Welcome to the channel Dewdear Academy. In this video, I am discussing the topic ectopic pregnancy. Some of the important facts about ectopic pregnancy. So, ectopic pregnancy means it is the narrowing or constrictions in the fallopian tube. So, the fertilized ovum cannot be properly transported to uterus for implantation. So, that is ectopic pregnancy. That is, it is taking place. It is found outside the uterus. The fertilized ovum cannot be transported to the uterus since there is any constrictions or narrowing in the fallopian tube. And the most common site of ectopic pregnancy is ampulla of the fallopian tube. So the chances for ectopic pregnancy is more in ampulla compared to the isthmus and interstitial part. Then the most common cause of ectopic pregnancy is pelvic inflammatory disease. So these are the some of the important facts about ectopic pregnancy. The most common cause is pelvic inflammatory disease and the most common site is ampulla of the fallopian tube. And which are the factors that is contributing to ectopic pregnancy? First is prior fallopian tube surgery. It is the highest risk or most important risk factor is prior tubal surgery. Then second important factor is previous history of ectopic pregnancy. So most important risk factor is prior tubal surgery and the second important risk factor is the previous history of ectopic pregnancy. Then other factors are the prior history of sexually transmitted infections, then the chances of sexually transmitted infections if there is multiple sex partners, then intrauterine devices, then age above 35 years. So advanced aging is also an important risk factor, then assisted reproductive techniques. So these are the factors that are contributing to ectopic pregnancy, and please note that the most important risk factor is any tubal surgeries, prior tubal surgeries, and the second important risk factor is previous history of ectopic pregnancy. Then all other factors are also important that include the history of sexually transmitted infections and the multiple sex partners, that is leading to increased chance of infections, sexually transmitted infections. Then intrauterine devices, advanced age and assisted reproductive technologies. Then ectopic pregnancy it cannot be carried to term. So that is another important factor, another important point that you have to notice. Ectopic pregnancy cannot be carried to term, it has to be terminated. And the incidence is 1 in 300 pregnancies. Regarding the incidence of ectopic pregnancy, we can say it may occur as 1 in 300 pregnancies. The most common symptoms or most important, the triad symptoms in ectopic pregnancy is there will be amenorrhea or missed menstruation. Then there will be abdominal pain. It is like sharp abdominal pain. Sharp pain will be there in ectopic pregnancy. That is the most important and significant clinical manifestation that we can see in ectopic pregnancy. Then vaginal bleeding or spotting. So missed menstruation, abdominal pain and vaginal bleeding or spotting. So compared to abdominal pain and vaginal bleeding, we can see the most important factor is in case of ectopic pregnancy, pain will be more important. Abdominal pain is the most important factor to see or the most important sign we have to assess in case of ectopic pregnancy. Then there is chance of tubal rupture. In case of ectopic pregnancy, if there is fallopian tube rupture, some of the other manifestations are there like falling hematocrit and hemoglobin levels, because there can be signs of shock. Even if the bleeding may not be evident that much, there can be bleeding into the peritoneal cavity, and so there can be signs of shock, and that include the tachycardia and hypotension. So tachycardia is the most important sign in case of rupture of the tube in ectopic pregnancy. So the manifestations in case of tubal rupture include falling hematocrit and HB levels. Then there will be tachycardia and hypotension. Then rapid thready pulse. The type of character of pulses, it will be rapid and thready pulse. These are all indicating the signs of shock. Then abdominal pain, that is severe knife-like or sharp stabbing lower quadrant abdominal pain is found in ectopic pregnancy. Then referred shoulder pain, then spotting or bleeding or spotting is common, and also in late sign there will be abdominal edema. Abdominal edema can be found as a later sign in ectopic pregnancy. So these are all the manifestations which is found in case of rupture of the tube. Then what is the management? So first is, if the tube is not ruptured, then we can provide the medical management, and that include the chemotherapeutic agents. And what is the action of, or what is the purpose of providing or administering this chemotherapeutic agents is, it helps to attack the fast growing zygote and trophoblastic cells. So the drugs which we are giving is methotrexate followed by leucovorin. So leucovorin, these are all acting as a folic acid antagonist. So that will be attacking the fast growing zygote and trophoblastic cells. So the drug of choice is methotrexate, leucovorin. Then after chemotherapy, hysterosalpingogram is performed. Hysterosalpingogram is performed after chemotherapy. So hysterosalpingogram means it is the visualization of uterus and fallopian tube. Then if there is tubal rupture, then it is very important to consider it as an emergency situation, because there will be extensive bleeding into the peritoneal cavity leading to shock. So we have to monitor the vital signs, mainly BP and pulse. Then we have to provide or administer fluids, blood or plasma expanders, and also we have to prepare the patient for laparotomy. So if there is tubal rupture, the surgical management is important and laparotomy has to be done. So these are the important management steps that we have to note in case of ectopic pregnancy. So thank you.